guidelines that we're going to be talking about with you at noon here today were developed, I think, in response to shelters specifically for women experiencing violence, and they were adapted from provincial guidelines that came out for primarily homeless shelters. And so there's guidelines for homeless shelters out officially from health, as well as guidelines for like continuing care homes. And we fall sort of somewhere in between the two. And so what we've done is we have taken the information from those two guidelines along with all of the other health directives and tried to put something together that is more specific for women's shelters. As we've been working with our members very closely, almost daily over the past 3 weeks, lots of questions have come up. The ACWS has done their best to go find answers to those questions and then put these guidelines together. The guidelines that we're sharing with you today, it is a living document, and it changes as more information emerges. I think for all of us, this is a first ever experience in our lifetimes, and we are learning as we go, and we're doing our best to gather the best information, the best practices, and the learning from the very innovative things that shelters are doing as well. We will share as we go through the guidelines how shelters have practically applied the guidelines and how they have been innovative in terms of the work that they're doing to keep operations going and to continue to meet the needs of women and children fleeing domestic violence. This is one piece of work that we've been doing over the past few weeks. We've been working closely with our colleagues across the country through Women's Shelters Canada, particularly around best practices, trends, what other shelters and other areas are doing, and around the federal funding that was announced coming out to shelters in terms of how that could roll out. We've been working closely with the government of Alberta, especially around the $5 million that was announced for supporting shelters and the flexibility that needed to come with that funding. We've been meeting with our shelters on a daily basis, and then on a weekly basis. We had the opportunity to meet with Government of Alberta this morning, and from those meetings we're able to identify and flag issues that we really need government to comment on or to help us find a solution for. In addition to those pieces, we've been working with Linda Baker and Western University to develop safety for women and children, and that information we will make available to you as it is developed and comes out through the Impact and SAGES. We're also now working with multiple service providers in the sector who don't specifically have expertise in domestic violence, but are service providers and are concerned and working with people experiencing domestic violence in their community, and are expecting a significant uptick in the number of people that are going to be looking for services during and especially after or on the tail end of the pandemic. So we're working now to put tip sheets and training packages together that can quickly get people to a comfort level so that they can assist those in their communities that are going to be needing some support in the days and months ahead. We've also been participating and learning a lot from the global network of women's shelters, and there are weekly webinars looking at everything from how what women are experiencing in other countries, how they're coping, the use of technology in terms of supporting women who are in isolation or in lockdown, and telephone calls are just not working, or physically going to service providers or shelters is not an option. So we're learning from other jurisdictions around the world as well as we proceed through our own journey here in the province of Alberta. So having said that, I'll ask my co-presenter, Krisha, to take us to the first slide.
Thanks, Ian. Okay, so we'll, if I can hit next here. So for today, we will be discussing these main points. So first, we'll be discussing the actions that the shelters and ACWS has taken to ensure the health and safety of our clients, our facilities, and our staff. Then we'll go on to talk about alternative programming and services that the shelters have implemented, such as offsite alternatives for counseling, support, and safe accommodations. And lastly, we'll discuss a little bit about the compliance with health directives. We thought before we get started to show you a quick video of how COVID-19 is spread. It's a great way to inform how to develop measures to implement in the women's shelter settings. So as you watch the video, put on a risk analysis lens, so thinking about what risks the clients, employees, volunteers will have, thinking about how we can protect them from those risks and how we will minimize the spread of the virus in the facility.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Great. So key takeaways from that video are how COVID-19 is transmitted. So it's transmitted mainly via person-to-person spread through A, larger droplets, like from a cough or a sneeze, and B, touching contaminated objects or surfaces, and then touching your eyes, nose, or mouth with that contaminated hand. So first, we'll talk about how women's shelters prevent illness and ensure the health and safety of our clients. So there are different preventive measures that individuals can take to minimize their risk of contracting the virus. These can be things like practicing physical distancing or limiting social gatherings, washing hands frequently with soap and water for at least 20 seconds or an alcohol-based hand rub, avoiding touching your face with unwashed hands, covering coughs and sneezes with an elbow or a tissue, increasing cleaning and disinfection of commonly touched areas, and watching for COVID-19 symptoms such as cough, fever, shortness of breath, runny nose, or sore throat that is not related to a pre-existing medical condition, and isolating those that are ill from the healthy.
So in shelters, we had started working on our emergency preparedness plans as a collective several months ago, and quite a few organizations that had gone through floods and fires had done extensive work on their emergency preparedness. and were able to, as a part of that, they had a pandemic plan as well. Others were developing their pandemic plans, but we were able to, as a collective, share our pandemic plans with each other. And so those that were quite advanced and robust were shared with shelters that hadn't really had the opportunity to learn an awful lot about a pandemic plan. So in the end, shelters were well informed in terms of these critical areas around preventative measures. And as a result of that, we were able to include the cleaning and disinfection as critical components of the guidelines, and watching for symptoms. Shelters have developed right off the bat screening symptoms for intake. They're using everything from taking temperature to brief questionnaires. They have not refused service to those that are symptomatic, but they have procedures in place that we'll talk about as we go through the presentation.
Mm-hmm. Yeah, so the next step to take is to plan ahead. Some of the things that, in addition to what Ian had mentioned, were priorities is identifying a space that can be used to accommodate those clients with mild respiratory symptoms and separating them from others. And if it is possible, designating a separate bathroom, providing meal service for that individual, and then planning for staffing and other services surrounding that. The second point about planning ahead is making sure that we are prepared to transport persons with severe illness to alternative isolation spaces. We understand that there are some alternative isolation spaces that may be available in different AHS zones or municipalities. And so shelters have been in contact with their AHS zones or public health contacts to identify those isolation spaces.
So just on that slide before we slip over, shelters right off the bat started thinking about, well, how do we isolate and accommodate clients that are asymptomatic or have mild symptoms, along with those that are symptomatic. And so some of the shelters, it's different across the province, for all of these things, depending on size of the community, the size of the shelter, the resources that are available in each community. But in some shelters, they were mixed. They're both emergency shelter and second stage. Second stage being apartment-like units. And so what they did right off the bat was they held 1 or 2 units as isolation spaces. Others that didn't have those options were thinking ahead about the use of separate bathrooms and the need, and have reduced their capacity. Instead of putting 2 single women in a room and having them both use the same shared bathroom, they did reduce capacity so that 1 single woman per room, and having single women and families within shelter having access to separate bathrooms has become the norm. In terms of transporting people with severe illness or confirmed COVID symptoms to isolation spaces, most shelters have been able to create very innovative alternative spaces, from hotel chains that are working with the collective to other options that they've created in their own community. But we still have smaller communities that have not been able to solve the isolation space because just the resources and the COVID response in their community is not robust enough at this time.
So what do people do if clients have COVID-19 symptoms? There are 2 different types of symptoms, as we know, for COVID-19. The first one is the mild symptoms. So as I indicated earlier, cough, fever, shortness of breath, runny nose, or sore throat that is not related to a pre-existing illness or health condition. And the second would be severe symptoms. So that would be things like difficulty breathing or pneumonia. So we treat those 2 differently. For mild symptoms, we immediately separate that ill individual into the designated isolation space. We ask them to take the online COVID-19 self-assessment tool. And then if directed by the self-assessment tool, call HealthLink 811 for further instructions. And for severe symptoms, we also want to separate the individual into the isolation space while awaiting. But if they do need immediate medical attention, call 911 and inform them that the individual may have COVID-19 so that the emergency personnel can be prepared for it. And we've been advised by Alberta Health Services that we are not to transport them to an emergency response or emergency room or a clinic, and we are to wait for 911 to arrive.
So shelters have been working with their health zones, some to a very high degree and some to a lesser degree. But we've had at least two regional and one provincial phone conversations with the emergency preparedness folks from health. And they've been very helpful in terms of reinforcing shelter best practices around mild symptoms, severe symptoms, and what to do if. There was just a call yesterday with the northern shelters and public health officials, and the information from that telephone call that shelters found to be very helpful is going to be added to the current guidelines. There was more learnings from that call yesterday. So this is an example of us learning as we go.
Mm-hmm. Right. In addition to those things, if clients have these COVID-19 symptoms, we develop so shelters have developed a plan for cleaning the room using proper protective equipment. So all cleaning staff should wear disposable gloves and gowns if it's possible. Gloves are for single use, so they are to be used only once and then to dispose of immediately after using to clean an ill person's space. It's very, very important that before and after gloves are removed, that hands are washed for at least 20 seconds with water and soap. In addition, things like laundry, when handling dirty laundry from an ill person, it's been advised that we are to wear disposable gloves as well. And again, discarding after each use and washing the hands before and after the gloves are removed.
The government of Alberta on personal protection equipment, gloves, gowns, masks, and a big thanks to Impact and Suggest on the non-medical N95 masks. They're very hard to get. About a week or 2 weeks ago, it was confirmed by Alberta Health that shelter workers were essential workers, and that they could order personal protection equipment through their Alberta Health local zone and through their grant liaison or grant advisors. And so shelters have been ordering personal protection equipment, but we all know that it's very difficult to get the personal protection equipment. Some shelters have received their orders, and some of the orders also include cleansers and sanitizers, things like that, and as well through Suggest and Impact, access to the alcohol sanitizer, hand sanitizer, soaps, gowns, and other personal protection equipment continues. And so we're doing our best, but as you know, it is very difficult to get some of these personal protection items.
So that was a brief overview of actions that have been taken to ensure the health and safety of the clients. So next we'll talk about how we prevent the spread in the facility. In order to prevent the spread of COVID-19 in the facility, some key steps that shelters have taken are: 1, enhancing their cleaning and disinfection practices; 2, having personal protective equipment and supplies on hand. So that includes ensuring that soap and drying materials in bathrooms are fully stocked, providing alcohol-based hand sanitizers, tissues, lined trash bins, masks, and gloves ready in case of an illness. In addition, posting signs at entrances and strategic places. So both Alberta Health and Alberta Health Services have on their websites different signs that people can put up in their facilities. Fourth is to minimize the number of staff members who have face-to-face interactions with clients. So in other jurisdictions, people have installed a sneeze guard or added an extra table in between the client and the staff member. And fifth is to limit visitors.
So shelters have been successful in either retaining their cleaning staff or finding others like cleaning companies, and have been working vigorously to constantly clean and disinfect throughout the shelter. And as we'll talk about later, just the general sort of universal precautions, food handling, things like that. And shelters have also have created schedules where employees can work from home, and they're down to a sort of a skeleton staff of support people in the shelter, supporting clients, dealing with crisis calls, things like that. And so far, shelters have been able to staff both the support pieces, like so crisis workers, child support workers, and the cook cleaning. And to date, only one worker in the province has confirmed COVID, and that was the case that you probably heard about. Dr. Henshaw talked about it, Sheriff King. That was a casual worker who worked a shift. They were isolated immediately. People that worked with that worker were isolated, and there has been no confirmed COVID cases in shelters to date. There have been people that have been tested in shelter, but there have been no confirmed cases to date.
Mm-hmm. And in addition to those things, the Government of Alberta directives are to not have any gatherings greater than 15 people. And we did receive an exception letter from Dr. Henshaw for our shelters. So normal operations greater than 15 people, they may proceed, but risk mitigation strategies such as physical distancing, ensuring that there's greater than 2 meters distance between individuals, must be put in place. And however, all non-essential gatherings that includes greater than 15 people, such as informal social gatherings, must no longer proceed. In addition, things like common areas, so eating halls, seating people at least 2 meters apart. For some shelters, this may include eating in shifts, or checking at the door to see if anyone is presenting with symptoms, and asking them not to eat in that area and to eat in a different area. And for food handling, as Ian had alluded to, it's important to remember that germs from clients, from ill clients and from ill staff, or contaminated surfaces can be transferred via utensils or the tables. So it's important to reinforce routine food safety and sanitation practices. So from the guidelines of the Government of Alberta, they indicated that wherever it is possible, we implement measures to minimize resident handling of shared food and items that may touch another client's food. This includes dispensing food onto plates for clients, removing shared food containers from dining areas, such as shared pitchers of water, coffee cream dispensers, salt and pepper shakers, providing prepackaged snacks only, ensuring that food handling staff are in good health and practice good hygiene, cleaning and disinfecting tables and chairs after each meal, and if possible, staff that are assigned to housekeeping duties are not involved in food preparation or in food service.
And so this is the sort of minimum that's being done right now in shelters, and it complies with the health directives. Some shelters have gone to preparing the food and taking the food to the client or the family room on disposable plates and cutlery and things like that. Others have gone with the shifts, but they are ensuring that they're meeting the minimum, and most shelters are exceeding the minimum standards in terms of distancing and ensuring that, because shelters are so communal, ensuring that clients are able to maintain that distancing that's critical from preventing the spread of the disease and any other flus and colds that could be going around as well. In shelters, the child support areas, and usually there's a lot of kids in shelter, those areas have been closed down either completely, or one family goes down at a time with a staff. They practice the distancing. Everything is sanitized after that family leaves, and when it's ready, another family can come down. Because as you know, like in shelters, emergency shelters especially, it's bedrooms, and so it's not apartment units where people can sort of be there comfortably for long periods of time. It's bedrooms. And so just in terms of how shelters are managing the isolation, the distancing, and basically giving people a break to get out of their room has been innovative and effective so far.
Right, so next we will be talking about how shelters ensure the health and safety of their staff. So first and foremost, in addition to all of the preventative measures indicated above, encouraging ill staff and volunteers to stay home. And as of March 25th, it's actually legally required under public health order that individuals presenting with COVID-19-like symptoms must self-isolate for 10 days, for a minimum of 10 days, and until the resolution of symptoms. In addition to that, shelters have identified clients, staff, and volunteers who could be at high risk for complications from COVID-19, and it's important that we do not designate them as caregivers for sick clients who are staying at the shelter, and encouraging them to stay home to avoid contact. And as Ian had mentioned earlier, considering having staff complete COVID-19 screening questionnaire and or a temperature check before the beginning of every shift. So AHS has expanded its testing criteria to include symptomatic essential service workers, so that includes shelter workers. So there is a special online self-assessment tool for frontline workers that's available on the Alberta Health Services website to help determine whether or not an individual needs to be tested and to get additional advice on COVID-19, such as the need to self-isolate.
So as you can imagine, this was and continues to be a critical issue for shelters that are operating and will continue to operate. And in the beginning, I think, we were kind of thinking, oh my gosh, we're going to go through the staff so quickly that we're not going to have enough staff to keep the doors open. Mm-hmm. However, again, knock wood, and to date, the actions that shelters have taken across the province have allowed them to maintain staffing for all the critical operations. And some shelters, for example, have actually, where they have people in isolation in hotels or in other areas, have staff that are working over in those areas. They have staff that are working in the shelters. They have staff that are on call, and they have outreach workers that are working from home. And so, thankfully, so far, shelters have been able to continue operations and staffing throughout the pandemic.
Mm-hmm. So next, we'll share a little bit about how shelters have been complying with the Government of Alberta public health directives. So it is very, very important that shelters are staying informed about the local COVID-19 information and updates and all of the latest public health orders. So these are available at alberta.ca/COVID-19, and Dr. Hinshaw provides an update every day at around 3:30 p.m. Next, it's important to identify key Alberta Health Services public health contacts for the specific AHS zone and or COVID-19 emergency unit. And as indicated earlier, as of March 25th, Albertans are legally required under public health order to self-isolate for 14 days if they recently returned from international travel or are a close contact of someone with COVID-19, or 10 days if they have a COVID-19 symptom that is not related to a pre-existing illness or health condition. In addition, go ahead.
Oh, sorry. The only thing I'll add to both these slides is that we are holding daily teleconferences with all the members across the province, and we also do a daily bulletin. And any of the new Alberta Health COVID-19 directives that come out go in that daily bulletin. They go out to all of our members, and they also go on a members hub so that members can access that information into the future as well.
Mm-hmm. In addition to those guidelines, other public health orders that may impact shelters are the physical distancing rules. So I had already alluded to this earlier, but the 2-meter physical distance for normal shelter operations for residents who do not have COVID-19 symptoms must be implemented. For gatherings greater than 15 people, normal operations for essential services greater than 15 may proceed, but risk mitigation strategies such as physical distancing must be put in place. All non-essential social gatherings greater than 15 people must not proceed. For a suspected or confirmed case of COVID-19, it's important to prioritize moving those clients to an external assisted isolation space, such as a hotel room or a designated facility as an isolation-only shelter. And lastly, symptomatic staff and volunteers are legally required to self-isolate. We thought it would be a good idea to just give a brief overview of the difference between isolation, quarantine, and physical distancing, because it can get confusing between these three. So isolation is staying inside while someone is ill. So this is what anyone who is sick with any cold-like symptoms should be doing. And as indicated earlier, this is for a minimum of 10 days from the start of symptoms and the resolution of symptoms, whichever one is longer. For quarantine, that involves staying inside while an individual is healthy. So this is anyone. This is what anyone coming back from travel and or are close contact of a confirmed COVID-19 case should be doing. And this should be done for 14 days. And physical distancing. So this involves taking steps to limit the number of people that an individual comes into close contact with. This may help to reduce the risk of getting sick. So that includes minimizing the number of times you need to be out in public. And when you do need to be out in public, maintaining that distance of at least 2 meters. This isn't the same as self-isolation. We do not need to remain indoors, but it is important to avoid being in close contact with people, and this is what everyone should be doing. And the government of Alberta has a physical distancing fact sheet available on their website that gives an overview of different things such as elevator etiquette, grocery shopping, public transportation, restaurants, things like that to help with the physical distancing. Okay, so now we'll move on to talking a little bit about how shelters have been providing alternative programming and services. So things like off-site alternatives for counseling, support, and safe accommodations. So firstly, things that shelters have done is including contingency plans for increased absenteeism. So these plans may include extending hours, cross-training current employees or hiring temporary employees, and identifying critical job functions and positions and planning for alternative coverage for those. In addition to that, planning for how shelters will continue to provide essential services to meet the needs of vulnerable populations. So this includes places to refer clients if shelter space is full, identifying short-term volunteers to staff shelter with more usage or alternate sites, and considering the need for extra supplies and surge staff, ensuring that they have proper personal protective equipment.
So shelters have been carrying out both of these areas. Some shelters have actually hired additional staff, cooks, cleaners. They've cross-trained, and they are able to provide operations. Even if their capacity is reduced, they're still able to provide operations at a very basic level. In terms of providing essential services, and if shelter space is full and they're needing alternative spaces, the collective has put together a Google Docs that they update daily, and it shows what shelters are full, what second stages are full, where the spaces are, who's willing to take in clients. And on that sheet as well, they identify the supplies and resources that they need. And again, working like through our networks, our hotel chains, different things, we've been able to find alternative space. We've been able to help with the finding of supplies, and again, thanks to Impact and Suggest for their work in that area. And the personal protective equipment, although that hasn't been perfect, we are able to order that directly through Alberta Health Services. There was something else I was going to say about that, but the other thing I wanted to mention about that is that where shelters have actually put people off-site and have included their staffing over there, there were implications for their insurance. And so anybody who's doing that needs to inform their insurance company that they are now serving clients off-site outside of their commercial facility identified in their commercial liability. And they need to work through the questionnaire that the insurance company will have with them about the off-site services.
So in addition to that, in order to provide alternative programming and services, shelters are encouraged to consider moving as many of their services and programming to mobile, remote, or technology-based services as possible. When considering new technologies, it's important to ensure that survivors are at the center of the decision-making. This technology-based services are encouraged to be implemented during the COVID-19 pandemic temporarily, and to reassess once the pandemic has passed. In addition to that, communicating with survivors through technology, yes, it has its benefits, but it can also present its risks, particularly for personal safety, loss of privacy and confidentiality. So it's important to consider what those risks may be depending on the type of service, and how shelters can protect survivor safety and privacy.
So sorry, I thought you were finished. Go ahead.
No, keep going.
You want me to go?
Okay, let me finish my last 2 points. In addition to that, analyzing and prioritizing services that are most needed at this time. So that could include safety planning, outreach, crisis phone lines, and advocacy and awareness campaigns. And it's important to keep in mind that programs and activities are executed in a safe manner. So balancing the needs of our clients and our residents with our own capacity to adequately staff the shelter or the program.
Okay, so I just wanted to mention that through the global network, with our sister organization in the US, the National Network to End DV, the NNEDV, has been working on the technology-based services for a number of years, and they have a global project underway now that's been underway for 4 years. And so they've done a lot of this work and a lot of this thinking. And for those of you that want more information, you can go to nnedv.org and look up the Safety Technology-Based Services Project, and there's a lot of information there.
Mhm. All right, so lastly, these are some additional things to keep in mind with regards to providing services during this pandemic. As we know from previous research, previous experiences with different humanitarian emergencies, these disrupt the physical and social environments that shape health and health problems, and that includes violence. So survivors of violence who are already more vulnerable to economic and health insecurity may experience increased isolation and danger due to the current pandemic. And survivors have specific needs and safety around safety and health, and it's crucial to take those needs into consideration. So firstly, organizations should not be using health status to discriminate in access to services. Secondly, reporting could trigger invasive inquiries that requires identifying information on all of the people who interacted with the reported person, so through that contact tracing. And that may result in breaching the confidentiality of multiple clients and exposing many of them to various harm. So important to keep that in mind. Thirdly, the people we serve may be at increased risk of adverse mental health outcomes, particularly during outbreaks of infectious diseases. And in addition, this emergency is not only impacting the people that we serve, but ourselves and our employees as well. So it's important to provide that mental health support and resources for both clients and for the staff. And fourth, it's also important to share accurate information and resources with our community to make sure that everyone involved has the tools that they need to respond in ways that are safe and supportive for survivors of violence. This may be a frightening and isolating time for survivors and for their children, and physical distancing may not always be safe for people who are surviving violence in their relationships or in their families. So our response should also include reaching out to others to ensure they have the care and support that they need, and if they feel safe at home.
So we'll kind of end the presentation there. I want to thank you, Krisha, for all your work that you've done, and we're so fortunate to have you working with us with your expertise and your specialization in this area, and it's been of huge value to the Alberta Council and to the members of the Alberta Council. So I want to thank you. I also wanted to say that, in terms of staff working remotely, it has been a challenge for Alberta Council, but also for our members, and that we want to acknowledge and thank Impact and others that have had great information on working from home and taking care of your staff. And there are things to consider with your staff working at home around their safety, particularly in the area of domestic violence as well. And there's more information available through the NNEDV site that I mentioned